Okay, everybody, we're doing a roundtable today, and we have Julian and Michela joining us. The first case we're going to discuss, I'm going to just give you some highlights, and then we'll chime in with how we can help this individual. It's a 12-year-old boy with shortness of breath when he's playing sports. He complains of a morning cough, and with some wheezing. They notice that the cough is worse when he has dairy. He also has eczema on his flexion surfaces, a family history of allergies, but nothing that's been like specifically identified in his case. And also his mom has some respiratory issues as well. So based on that, where do we get started?
Well, eliminate dairy. That should be.
Yes, that's always music to my ears. But
Um,
yeah, you want to look at the symptoms and like figuring out what's going on.
I would ask if he's seen a respirologist to do the respiratory test to confirm asthma or not.
So you're thinking asthma.
Yes, I am.
All right, let's just assume that he did see his respirologist and it is true. He has asthma. Now what?
Mm, Along with the dairy removal, like Julian said, I would definitely place him on an omega-3 for the anti-inflammatory benefits.
Yeah? Okay. What do you think about that, Julian? Be honest.
I think it's more, family history of respiratory symptoms.
Hmm.
Um, Going down to the bottom, if they've lived in the same current house, because if someone all has respiratory conditions, they all could have potential mold issues, which creates an allergic response as well. So while investigating, working on things in the meantime, investigating potentially if they're being exposed to something, creating that allergenic immune response, since it's not just one individual, it's potentially two or more people. So then eventually the courses of treatments and supportive supplementations could change as time goes too as well, right? So if they do have if they're even reacting to dairy, creating a lot of mucus, sinusitis issues, is there some sort of potential pathogenic issue going on internally in the gut that's creating that, hey, I'm getting a stuffy nose or shortness of breath because it's creating that inflammation response to the individuals, creating that symptom picture, right?
So what would you do?
First, yes, I would ask about the household, how long have they been living in the current situation house. You can, sure, we've talked about the no dairy aspect. You can give things like antihistamines because an antihistamine could, if it starts to alleviate some of the symptoms, then you know there's a histamine potential issue involved, and you have to dive deeper to understand, okay, what's causing their histamine issues to actually flourish. So,
Sure.
things like quercetin, stinging nettle, bromelain could potentially even help. Or kids too, they can take like a liquid, liposomal quercetin, right? Easy for them to take. It's delicious for them. And if they notice a symptom improvement, then as for us, it's like, okay, we really need to dive deeper to understand what's really going on at that deeper level, right? It's almost like a test because if it's improving, it would only improve to a certain amount, right? You don't want to stay on, an antihistamine type of supplement forever and just mask the symptoms. You kind of really want to understand from the foundational level, that's the gut that's producing this immune response, right?
Sure. Okay. So, I mean, your take on it is, sure, it might be asthma, but is there something precipitating this that it's more uh like invasive, like I'm almost at like at the family level, like something like because I think when we were coming up with the case, the little hint was like the mom has respiratory, like the mom has a history of asthma,
Mhm.
like almost like from her childhood. But it was interesting. You had to take that, like maybe what if it's something that's like more temporal right now? Maybe they live in a moldy house, and so wondering if like, testing the house or testing the individual for mold exposure as a like an activator or whatever is in the background that's lending itself to the surface symptom of the asthma per se.
Exactly, yeah.
So so it's a no for the fish oil?
I think fish oils could be calming, like to the, it's like it could be some sort of an antihistamine too. So it's never, I wouldn't say it's the
Well,
sole
Michaela,
thing to use.
take it. You take with the fish oil. I don't mean you should take fish oil. I'm saying like take that point. Like where is that coming from? What's your like point of reference?
I think it's because if there is a genetic linked component, I'm not saying that there's no potential mold exposure aside, but if you start introducing anti-inflammatory nutritional supplements into the diet, it may actually reduce some of the immune response that is causing the asthmatic and eczematous symptoms. So,
Then yeah, the eczema, I think that is a good point regarding the fish oil because we kind of glossed over that, but the eczema is present. So yeah, that's good.
mhm. But even with the fish oil itself, right? Because it's saturating a lot of those like anti-inflammatory fats, I guess, that are being produced within the body. And then it's allowing the immune system to even calm down itself. But then you have to ask further questions as well. Like, is this just exercise induced? Is it weather induced? Are there any confirmed allergies as well that can be potentially causing the asthma too? Because then you want to be removing those allergens to then like allow the symptoms to subside too.
Okay, so
So,
if this was your patient, what would you do? What tests would you measure?
well, I would probably refer them to an allergist as well, just to confirm.
Oh,
Well, just to
keep it in
confirm.
house. What can we do? I'm just joking.
I know, but I'm saying because allergies are a thing. Like even for example, dust. Dust
And you
is
can quote her. Allergies are real, folks.
No, I mean they are a very big cause of asthma and eczema. People kind of overlook them a lot, but a common allergen that I've seen is dust. And I know a lot of kids specifically have like stuffed animals and things in their room, and they collect dust, and then when they notice that they either clean them or remove them, their symptoms do tend to subside. So that could be a
So
reason why.
is the dust the cause or an aggravator?
Probably an aggravator. Their immune system is most likely hyperactive, which is why they're responding like that towards the dust. But it's more of removing a lot of the external burden that's
Yes.
in their current environment. So you can kind of mitigate the immunity, like hyperactiveness, while you work on maybe the underlying cause.
What would that be? Potentially.
I don't know, I guess it's very different for everybody. If there's a very strong genetic component, then it could most likely be genetics.
Boo. I'm just joking. I think that's going to be my new thing. If
Boo.
I disagree with someone, I'm not going to just quietly sit. I'll just start booing. Well, okay, but I want to know, like, if this kid comes into our office and says this whole history, what am I going to measure? I'm not going to be like, well, go see an allergist because you know what's going to happen? They're going to go see an allergist, and either they'll react to everything, which will be misleading. They'll get an EpiPen, which I don't know if they need it, they need it. Or a lot of false negatives, or they're just looking at environmental because what if it's not an environmental trigger? What if it's the dairy or other food or nuts or eggs or something that it's not causing an acute allergy, but more along the sensitivities.
You could do a
So,
food sensitivity test.
yay! That's the other
Yeah.
side. Now I'm like, it's a boo or a yay from me.
Yes, but sometimes you do have to take those with caution because let's
Back
say
to boo, Michaela. What are you doing?
no,
Food
because
sensitivity
let's say if the patient has like an extremely leaky gut, there's obviously going to be a lot of reds and yellow.
causing the leaky gut.
Yes, but I'm saying there's going to be an elevated amount of reds and yellow foods. So then you
Yeah.
kind of, but then you have to use your clinical judgment. Are you going to look at this food sensitivity test and remove every single red and yellow food?
Oh, what do you remove?
You remove, I would say, like the biggest allergens, the most inflammatory foods, and then you monitor. either progression or like stagnation with the condition, and then you see how it goes. But some foods can also cross-react with one another too, so you have to be careful with your interpretation sometimes.
Is that your honest opinion? Or you just said it because you know that's what I like?
No, that's actually my honest opinion.
Oh, that's good. That's good. Okay, so we instead of just saying, yeah, you have asthma, take a puffer, we just said your whole family has mold exposure and you can't have gluten or dairy anymore.
No, we didn't say that.
I mean, I'm kind of saying,
No, we said it was a potential, a
yeah, but that
DVS.
these are the things that we have to rule out. So a
Mhm.
case like this might seem very simple or self-directed in the first, and they're like, well, he seems to be better with a puffer or an inhaler. It's like, yeah, that'll work for a little while, but like then he gets a bad cold and then he's on like prednisone or he's prone to bronchitis and he's on antibiotic and all this kind of nonsense starts to spin around and before you know it, he's on prednisone and stuff. So it happens. It's a progression. So we're trying to identify along the way what's being missed. Because a lot of it is like it could be, it may not be, but there's where there's smoke, there's usually fire. So we're gonna
Yeah,
steal all his teddy bears.
I personally would, I mean, just from the functional side, I with knowing the symptoms in case, I would run an organic acid test because that can give segue into mold. It's not a mold test, it's not a mycotoxin test, but on the test, I'm looking at yeast bacteria, which has an affinity to eczema as well. Plus, it gives me detailed onto like if they have Fusarium or Aspergillus, that can prompt me into like, hey, now we put value into testing the house because if there's exposure somewhere. Plus, that gives segue into mycotoxin testing. And if those levels come back, then you know we have a source of exposure and potential. Like now you're dealing with a biofilm, which is the treatment kind of changes too, right? So getting to the root sources, yeah, test gives you segue too. So it's like, what's the value of the test we're actually running, right? And what it points towards, but it's picking off yeast bacteria and Clostridia as well. So it's like, here's good, more root or causes potentially to rule out from the top down too,
Right, right.
right?
What a controversial case. It was Michaela's idea, right? You said let's do one on asthma. And you thought it'd be easy. And I thought,
The
to be honest, when we were doing, I'm like, we're just gonna segue this into the red light and glutathione nebulizer. We just
best stuff.
that would be good. That would be like probably like that's the during our first session, that's what we would do. We would say like, hey, you know what? Let's get you in front of the red light. Let's get you on the nebulizer for a little bit, 10 minutes. Let's see how you do. Let us know how your cough is in the next few days and the respiration. If you feel like you have a little bit more, capacity, something they can do at home as well if it was agreeing with them. So that's a very like step one. But I think we sort of did step five, six, and seven first. We dove down really quickly. Did I
I
miss? Sorry, go ahead.
I was gonna say, I also feel like just simple questions such as bowel movements, consistency, frequency, color, as well as digestive symptoms are really important because if somebody is not excreting what they're consuming, then there's going to be like a further buildup within the body, which can lead to a greater inflammatory response. Since we know that the mucosa in the gut and the respiratory tract are somewhat affiliated, even like the IgA levels too. And then if also the person is a poor methylator, for example, or they have very slow detoxification within the liver, that means their body has a lot of burden. Like they're not detoxifying properly. The flow is a little bit stagnant as well, which can contribute to some of the symptoms too, like especially with the skin. Because the liver, the skin, the gut, the skin, they're very, very highly like connected.
It's true.
Mhm.
So this case is like maybe the what we described is sort of simplistic, but when an individual like this comes in, these are all the little rabbit holes that we have to go down and follow and be like, okay, you know what, there's a lot of gut stuff going on here. Maybe we need to clean that up first and address that and figure out what's if there's an obstacle here that just sort of aggravating what might have been just a very mild condition.
Mhm.
Interesting. Do you guys have is anything else, or I can go on to the next case? I think you'll be okay. Just give him a puff, he'll be fine. No?
No, give them the glutathione and red light.
Yeah, that's what I was hoping someone would bring up.
Well,
Case.
it's just I think kids detoxify even like they're more resilient too, I find. So it's almost like I wouldn't say step one, but potentially step one is increasing the ability to detoxify and then seeing how symptoms are going. Plus, you have the glutathione on board, the red light, so you're working on multiple things at the same time. So then you kind of see reactions. You start with 10 minutes, see how they do. If they're doing fine, potentially increasing it, and then you're kind of diving down deeper to understand the deeper causes, whether it's using testing and whatnot too, right?
I like it. Let's go to the next patient. They've been patiently waiting. A 25-year-old female, and for the last 6 months, she's been having bad cramps with her periods. Her acne is worse before her flow. She's been noticing increasing cravings for carbs, and she's been a lot more anxious. I kept it simple because we have a tendency to hyperanalyze, but let's go down. Let's go see who wants to go first.
Okay, first things first, she had her hormones measured.
How?
How?
Yeah, like what test?
Well, the simplest test would be through blood, going on day 3 of the cycle, since the hormones are pretty much the most stable at that time. You want to look at the estrogen to the progesterone ratio. You also want to take in FSH and LH into account as well. And you even want to measure the androgens like the DHEAS as well as the testosterone because you want to see things like PCOS if it could potentially fit in the picture.
All right, let's say that all her blood hormone levels are in normal ranges.
Normal?
Yeah.
Then you can start asking digestive questions because a lot of the times the liver is highly connected to the menstrual flow. Like pre-symptoms and the actual period symptoms itself is highly correlated to the liver. So, like emotional wise, could be PCS. Also, when you have stagnation in the liver, it can lead to severe cramping as well. It can also lead to digestive concerns like bloating and constipation. So, that's something to consider.
Consider it.
Okay, well, if we're considering it, then you have to think, is the patient properly detoxifying and excreting specific hormones like estrogen? Is she very
Oh, the blood was normal.
well, you don't know that because blood it fluctuates a lot though. Like it would be deemed normal in the labs, but it tends to fluctuate as well throughout the cycle.
What about let's just hypothetically say we measured every day of her cycle and her hormones are all within normal ranges. Now what? Julian will get them to do an organic acid test
Probably.
at some point.
Yeah.
And it'll be right to do so.
Has she had any pelvic ultrasounds?
I mean, that might be a good idea.
You want to check for things like fibroids, maybe if they can see any endometriotic tissue.
Is it common for a 25-year-old to have fibroids? Is it possible? Yes. Is it common? Not that common. Bad cramping in your mid 20s, that can happen.
Mhm.
I'm almost thinking that this might be a little bit more of an adult onset with the acne and the cramping because a lot of like younger like teen girls will say like I have terrible dysmenorrhea, like she misses a day of school, but not in this case. This is something that maybe started a little bit later in her mid 20s. What are some things that we can look at outside of like theoretically what the liver that we always talk about, we blame the liver for everything.
Well, like the nervous system piece, right? If you first just work on the nervous system component and see what symptoms reside, and you start to get true pictures of what symptoms are actually there, whether it's going to be gut related or liver related, or if the gut's affecting the liver too, right? So it's like lowering someone's stress response, inflammatory response to actually get, true measures. If the person's been, anxious and now craving carbs, to me, it's like that's potentially more like gut stuff going on, candida, bacteria, right? So if you lower the first thing, the stress response, do they still crave carbs and are they still anxious? If they still are, then you're really dealing with something more gut related.
Okay. Does the nature or the kind of cramping influence what you might look at or assess? Because not all cramps are made the same.
Mhm. Is it like radiating cramping, sharp cramping?
I don't see a Brady in your contacts. Who do you want to call?
Oh, don't call it Siri's getting involved.
To who?
No, cancel Siri.
Okay, I won't.
Thank you. Please don't interrupt when we're talking. I don't know, Michaela, did you bring up who's Brady?
I don't know. I didn't say radiate.
Can you repeat what you were saying? Because Siri threw me off.
Radiate.
Oh, there's a pain radiate. I mean,
Yeah, it's
it's
sharp.
okay. You describe like okay, sharp, radiating. What does that mean to you?
I guess this makes me think more of like a Chinese medicine picture rather than like a westernized picture. Sometimes when, like I said with the stagnation piece before, like it can show up with certain types of cramping. Like the more stagnant you are with blood or with cold, then it's sharper pain. Like something is stuck, it's not flowing properly, which is why your body's like so tense.
Right, so that kind of like adds to the picture in my mind.
Mhm.
Let's say that this patient is, let's say she's 5'9" and she's 105 pounds. Okay.
Okay.
Does that alter the picture or add to your suspicions of what might be happening
Mm.
in
If
a
we're still
TCM?
going, yeah, if we're still going the TCM route, I would probably look at the spleen from there
Yeah.
because she's probably a very anxious individual, which does damage the spleen overall. And the
What made
spleen
you
is,
say she's anxious? She is.
well, it's the anxiety and the craving carbs part.
Really?
Yeah.
Not being too thin?
No,
I would
and
say
as well, but it
underweight.
was the
Yeah.
initial symptoms, yeah. But spleen wise, because if the spleen is damaged from the overthinking and the anxiety, that means it's not really like breaking down and dispersing those nutrients properly toward like throughout the body for certain pathways and mechanisms to go on. But then going back to the liver, even then, because they're so closely connected, it's like when one is overactive and taking energy away from the other, it depletes the other, and then it kind of ruins the energy flow throughout the body.
What do you think her body composition would look like?
Probably very low body fat, but like low muscle mass at the same time.
For sure, low muscle mass.
Mhm.
I would say she probably has higher body fat, higher than expected.
Okay.
I don't like the term skinny fat, but that might be kind of where um I'm seeing someone that likes carbs, probably doesn't digest protein very well, probably very anxious, and then that affects their appetite. So maybe skewing their normal breakfast, lunch, and dinner routine, but then they end up snacking because they're calorie deficit and they're hungry. Carbs are easier to digest and absorb, not breaking down protein, so their muscle mass is low, but they're starting to store fat where you don't want it, especially around your organs. So leading towards a little bit of a fatty liver, like but a thin frame, starts impairing normal liver function, starts affecting mood and hormones, and maybe partly explaining the acne. Maybe artificially bumping up the estrogen that maybe it might be too early to see. Is there anything else that we can test for other than the blood hormones?
I mean, you maybe could do a stool analysis at the same time to check the level of dysbiosis.
Yeah.
Because Sometimes dysbiotic bacteria and that inflammatory response does affect menstrual cycles because of the proximity of the two.
Sure. Let's say she does have she goes through bouts of constipation, which is also consistent in a picture like this. What would you do for that besides a stool analysis?
Are we thinking like temporary relief or more long term?
You're the doctor.
Well, depends how bad her constipation is, how many days she doesn't have a bowel
She
movement
goes
for.
twice a week.
Twice a week. What are her hydration levels like though?
Sufficient.
Fiber intake
Insufficient.
and then
What'd you
activity.
give her?
Well, I mean, you could do a prebiotic, I guess.
Do you think that's what I'm thinking?
No.
I'm not thinking that. I mean, not a bad idea, but
Well, you could start with dietary fiber if she's very, like, if she's lacking it in the diet.
I bet I'm assuming she's missing it. She's not getting enough in her diet.
Okay, then you can start by slowly increasing the fiber intake so she doesn't get any rebound symptoms of bloating or abdominal pain.
But what if she's a picky eater and she doesn't digest well?
You could give her a fiber supplement.
Okay, like
Mm, well, if she's a true,
Doralax.
yeah, yeah, you could.
You could.
Yeah.
Is there something better?
No, I was thinking just like if she's too constipated, you don't really want to put a soluble fiber supplement because then that can aggravate some of the symptoms. So you'd go more the insoluble fiber route.
So you're going back to the prebiotic.
No.
It's not a bad. It's insoluble. What do you say, Julian?
Yeah, if you're incorporating like the prebiotic, you'll obviously titrate it up. Like you find your happy medium, especially with people who are, let's say, picky eaters too.
Mhm.
Um, sure, in bouts of like chronic constipation, using more natural things like magnesium citrate or even vitamin C. But even like the whole inositol pitcher too, which can help digest carbohydrates as well.
Yeah, bring
You're
that
kind of you're
back.
kind of yeah, you're kind of seeing signs and symptoms what even at a specific dose of a fiber, right? It's not like they're starting off with massive amounts. It's okay, start lower, see how you do it. If you react at larger doses, okay, go back to the happy medium dose that that's providing that supportive benefit, day after day, week after week, and then obviously finally reassessing to see what other symptoms are still in play, and then start diving deeper into the case if it's applicable, right?
What if the patient says, "Hey, I was on Instagram and I saw something about Dutch testing."
You can do a Dutch test for sure.
Oh, what is it going to show? Excuse me.
Well, it shows you like your metabolism of certain hormones, right? Obviously, it looks at the whole liver component, how you're metabolizing through the different pathways. Obviously gives insight into the whole like methylation piece picture to the person as well. So it's a more in-depth hormone picture than your standard blood test, right? Where a blood test is measuring in the moment. So technically you would test, more often, whereas in Dutch test is looking at, more of a metabolite grand scheme of things, liver function, different pathways to your unique
Adrenals.
to your adrenals, to your own uniqueness too, right? And that's where it's becomes more personalized and gets more data and detailed even from like genetic sides of things, sure, right? How do
Yeah,
you support someone's metabolism? Because this is how they metabolize certain things too, right?
I like that. That's a good answer. I tell everyone hormone testing via your blood tells you if you're pregnant or in menopause, and that's it. And if you're not either of those, it's not going to help you. Well, Dutch testing, that fills in the blanks for me. Okay, so we have to give this patient three supplements. You both get to choose your own three. So remember, I called her skinny fat. She's got bad cramps and her acne is worse and anxious. Three supplements. She's coming back in 4 to 6 weeks. So we'll know how the next period goes. Take your time. And don't presume to know what I'm thinking, because I'm predictable. You might be wrong.
Well, I like inositol just because it tackles most of the symptoms in this case, right? So you think of like, sure, it can help with the nervous system component, can help with bowel function as well, could help with carb digestion,
Killing
right? So
birds with one stone, I like it.
yeah, and you can always, increase the dose to have more laxative effect if the individual actually really needs that as a tool. Right? Oh, I'm more constipated, sure, increase the dose. Things are flowing, okay, perfect. It's also calming at the same time. Kind of get a better reading on her symptoms too. Like, is it actually helping with multiple symptoms, or is it just helping with this one symptom? Say it's helping with, I don't know, her anxiety. It's more calming, but I still have, the cramping, and maybe I still have like the carb sensation,
Okay.
right?
Yeah. All right. Inositol. And
Inositol, I would use potential other things just to like just stress support potentially. So, um, I mean, I use things like silk tree. That's a South African herb, so it's really calming to like the liver and heart meridians. It is also like an antihistamine, so it can work on, whatever is giving off some sort of inflammation. It can help, calm things down, right? So, bring them more into present moment, reduce the stress, reduce potential any histamine mediators going on at the same time. Again, bringing their load down, which is kind of the goal too, right? To see what's really driving this person to kind of have reactions or symptoms,
sure.
right?
Okay. That's good. Was that three?
Actually,
That was
um,
two, but that kind of tackles a lot.
All right. Hey, you know what? More power to you. Can I
oh,
take one of yours? I can pick four.
Yeah.
yeah. Sure.
Okay, Michela, you go.
I was gonna say on top of the inositol, because I do like that multi-purpose idea of a supplement. Milk thistle is also a really good herb too, because it's both hepatoprotective and it's a hepatic. So it's not only supporting the phase 1 and phase 2 detoxification, but it's also protecting the liver from like future fat depositions that the patient's experiencing. So I think that may even help regulate some of the flow, like pain-wise too. And then the inositol as well for the anxiety and the carbohydrate digestion. But sometimes when you tackle the liver, your emotional burden also decreases too.
Yeah. Okay. Was that
Mhm.
three?
You could
Guys,
do,
you guys have an extra spot. You're leaving empty.
I would say ginger in the meantime,
Why?
just for pain relief, depending on how bad the pain is. Like if it's very debilitating for
Ginger for pain? I
you.
can't say. I don't know. You swear by it.
Not that I swear by it, but for some patients it actually works quite well, but then for others it doesn't. Either that or some patients do have really good results with raspberry leaf tea. Yeah, because it's a uterine tonic, it promotes like optimal blood flow, it does help with symptoms of dysmenorrhea as well.
Interesting. I
Mhm.
like it. All right, my three. I won't say inositol because you guys already picked it. But what I'll do is I will go with a vegan protein powder. She's not getting enough protein. And we need to build up her yin. And if she has more yin, she might not have so many of these um, inflammatory type of symptoms like pain and acne and that sort of thing. And I'll help with her body composition, help with her nutrition, might help with her mood too, might help with her sleep. I didn't say she had a sleep problem, but protein, especially high dose of protein in the morning, going to help you sleep better. I would do a formula sort of like Pasco Femin by Pasco for hormonal symptoms and like cramping. And so it's a combination homeopathic. It does seem to work for some people really well. And then my third choice, I'll do, I'm debating between a fish oil or a prebiotic. maybe the fish oil. Maybe just to get rid of some of that fat, help with hormone processing, inflammation. I'm outside of my comfort zone because you guys took my inositol. Okay. What do you think is going to happen in a month?
May or may not see improvements.
Oh, no, we have to see improvement. That's for sure. We guarantee that we're going to see something. Less cramping, better acne, like less acne. Maybe her body, her muscle mass has gone up. Maybe feeling less anxious. Okay, cool.
Yes, for sure.
Yeah, I'm happy. And then we can go over her Dutch results. We got 3 nodders. Okay. All right, guys, this is fun. We'll do it again. Goodbye.
Love to. Bye.
And once it's Friday afternoon, everyone's sleepy. Okay, see you guys.